Good morning. Hope everyone survived all the rain that we just had and is doing okay from that. For those of you who had flooding problems, we certainly are thinking about you and hope everything works out soon. Today, I want to talk to you about a subject that has really been quite misunderstood over the years, and I want to try to clarify some of the misnomers or myths that you may have heard about. One of the most important hormones in the female, which is testosterone. Now, the minute I mention that, I'm sure the first thing that happens is a bunch of flags go up saying, wait a minute, testosterone is a male hormone. Well, yes, men have testosterone, but women have testosterone too. And in fact, in your 20s and 30s, you made much more testosterone than you did even estrogen. Testosterone is an androgen, and it's mainly secreted, at least early on, by the adrenal glands, and is a very important androgen, as it has effects on all kind of tissues in the bodies. There are receptors in numerous tissues in the bodies: the bone, muscle, fat, the heart, the breast, the brain, and I could go on and on, that have receptors for androgen, and testosterone is our most active hormone in this fashion. So don't think that just because you hear the word testosterone that it is nothing but a male hormone. It is very important in women, and it's important to know that at least initially, until the adrenal glands gradually decrease over the years, that it was made in much more abundance than estrogen itself. Secondly, another myth is that testosterone's sole role is to increase sex drive. Well, granted, it will help with libido, but there's so many other important aspects of testosterone in your body. And you need to be aware that yes, the sex drive is better, but you're also benefiting other aspects that we're going to talk about in just a minute. Another myth is that testosterone masculinizes women. Well, if you take it in massive doses, it surely will. And that is not a good thing. But if you're taking bioidentical hormone just to optimize the normal levels within the female body, it does not masculinize women. That is something that's been disproven by numerous medical studies and over the years, and these are long-term studies too. A fourth one is that testosterone causes hoarseness and voice change. Well, in very massive doses, it can cause deepening of the voice and hoarseness. However, naturally, as we age, our voice gets a little bit more hoarse, and our voice changes a little bit. Hey, is that from the fact we use it a lot? It could be, but it is not because of testosterone. In fact, women who don't have optimized testosterone, their voice is going to change, and yet their testosterone levels are very low. So just bringing those levels back up to optimal levels will not cause any voice changes. Another is that testosterone causes hair loss. And now we know right the opposite. Testosterone is effective on the hair follicles and helping hair grow. In fact, there was a medical study that came out that showed over 58% of the women who had their testosterone optimized had an increase in hair. So that's a very positive thing, and it's very important to realize that is just an old myth that unfortunately is still today being propagated. Yes, testosterone being converted to diethyl testosterone peripherally in men does cause some pattern baldness, but that's not associated so much with women. Another is that testosterone has an adverse effect on the heart. Well, we know now that the opposite is certainly true. That testosterone, because it enhances the immune system, which in turn decreases inflammation, protects the heart. and so therefore your heart is protected. Your vessels form less plaques because of the decrease in the inflammation that normally causes plaques to form. And so this is very important for folks to understand that testosterone itself is not going to cause heart problems. Another is that testosterone causes liver damage. Now, I think a lot of this came from bodybuilders, athletes, etc., that took oral testosterone, which was a synthetic testosterone in very massive doses, trying to increase muscle mass and their enhance their athletic abilities. Did cause some liver damage, but when it's taken in that fashion, it has to be processed by the liver, and that's why it happens. If people take bioidentical hormones, it is not processed through the liver. It is absorbed directly from the skin or subcutaneous tissue, depending on whether it's a cream or a pellet. And it does not cause any damage to the liver, and this has been proven by numerous medical studies along the way. The other is that testosterone causes aggression. Well, that is certainly probably from the same aspect that we just talked about, of where synthetic testosterone was taken in very high doses, and you heard a lot of times athletes or others who were taking steroids, anabolic steroids, etc., got more aggressive. Right the opposite with bioidentical testosterone when it is optimized to the correct levels. And in that case, we have a situation where it actually decreases anxiety, helps calm moods and mood swings, so it's got a very beneficial aspect. The third, is that testosterone increases the risk of breast cancer. We now know this is totally incorrect. If anything, testosterone is protective to the breast, not that it causes increase in breast cancer. As I mentioned in our last broadcast, a lot of abnormal or incorrect information, that would be the best way to put it, came out years ago in the 1990s when a study was done, and they followed women who were taking synthetic estrogen and synthetic medroxyprogesterone. And those women were shown to have an increase in breast cancer. But as they followed it further, and physicians were complaining initially when it came out, but unfortunately it got on the news and in the newspapers way ahead of physicians being able to look at the study, said this is not what we're seeing. And they have followed those women now for another 10 or 15 years and are actually showing that women who were on, even if it was a synthetic estrogen, had a lower risk of breast cancer than women who took nothing, and it was only in those who took the combination of estrogen and the medroxyprogesterone that had an increase in breast cancer. Testosterone does not cause any increase in breast cancer, and this has been proven through numerous medical studies, and this is very comforting to tell women that we're not going to increase your risk of breast cancer. Also, we now know that bioidentical testosterone does not cause an increase in blood clots. So there is hope for those women who may have had a blood clot in the past and are told they can't take any hormone replacement. We now know that if it's bioidentical, that we don't have to be concerned about that. And one of the last ones I want to talk about, and I think I've kind of alluded to this in as we talked through the other myths, is that the safety of testosterone in women has not been established, and that's just not the case. There have been some very long-term studies that were done over 10 or 15 years, so it's not like it was a couple-year study. This is watching women for a long period of time, and they've shown that optimizing the testosterone levels with bioidentical testosterone, which mainly bioidentical means it's identical to what your body makes on its own, does not cause any adverse effects with women. It is very safe for women to take, and so we have established that the safety of testosterone. So now that we talked about some of the myths, what are some of the what are some of the benefits of testosterone, especially bioidentical testosterone? One, it enhances libido. That's a known factor, and unfortunately, the synthetics that have to give by mouth we avoid because of some of the side effects I mentioned before. But yes, testosterone does improve sex drive, trying to get your sex drive back to like it used to be. It is protective to the heart. As I previously mentioned, it has an anti-inflammatory effect, so therefore there's less plaque buildup in the coronary vessels on women who have their testosterone optimized. It helps lower cholesterol and LDL cholesterol, which is your bad cholesterol, and it increases the production of HDL cholesterol, which is the good cholesterol, which is more cardioprotective. Testosterone increases your energy. It enhances your sleep and helps you sleep better. It gives you an overall feeling of well-being. As I mentioned before, it helps reduce the mood swings and anxiety that comes with low testosterone. It helps reduce body fat. So, and I'm not touting it necessarily as a drug for weight loss, but we do know that women who are trying to lose weight and have their testosterone optimized are able to do so much more successfully than those who do not. It causes stronger bones and muscles, helping reduce the risk of osteoporosis and helping the peripheral muscles be stronger. Therefore, the stronger the peripheral muscles, the less likely for falls and better balance, etc. And we could go into a lot of advantages with that. It helps relieve depression, although it is not advocated as a absolute treatment for depression. We have seen a lot of studies where women who have their testosterone optimized are able to get off of some, if not all, of their antidepressive drugs just to feel better and have a much better sense of well-being. And the last one I'll mention, although there are many that we could talk about, but time is somewhat limited, is that it reduces brain fog. I don't know if you are experiencing the fact that your brain seems to be a little foggy at times, for whatever reason that may be. Testosterone has been shown to help a lot with that, and we've heard that testified by our patients who are receiving bioidentical testosterone that, hey, my cognitive skills are getting better. I don't feel as foggy, and I think I seem to think better and think through things better. Those are all positive effects. So I wanted to take this time today to talk about, in general, the advantages of optimizing your hormones. And I've talked about testosterone. Last time we talked about estrogen and progesterone. But in the future, we'll try to go into some of these in more depth. But if you have questions, or if you want to know, hey, what can benefit me, please feel free to give us a call, 843-572-7123, and we'll be glad to set up a consultation so we can discuss that with you and show you the benefits that come from optimizing your hormones. Thank you for joining us today. I hope you have a great rest of the day and rest of the week, and we look forward to talking with you again in the near future.